This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
Good morning. My name is Katy Cook. I am the owner of ADK Health Solutions, and today I am going to discuss with you assessing clinical service needs, telehealth readiness. The focus of today's presentation is specific to federally qualified health centers. So let's jump right in. In today's video, we will be walking you through the high-level steps to conduct a telehealth readiness assessment for either implementation or scaling up of an existing telehealth program or service line. Determining your health center or organization's readiness to implement or scale up a telehealth program is a necessary first step toward ensuring success. A telehealth readiness assessment tool can be used to capture information about gaps that are identified, prioritize strategic areas for strengthening, identifying the resources that can address any areas of deficiency, develop action strategies, and monitor results. Some of the topics we're covering today include why conducting this type of assessment is important, organizational stakeholders who should be involved in the process, key focus areas to consider when assessing readiness, and what to do with the results of your assessment. How does your organization move forward, and what are the next steps? The rapid evolution of technology is increasing the capacity to deliver healthcare services remotely. Telehealth technologies offer new delivery models that allow providers to extend services far beyond their current reach, using smartphones, computers, and other web-based mobile devices. Telehealth is truly here to stay. There are several forces driving the increased use of telehealth outside of the COVID-19 pandemic. This includes new innovations in technology, a growing body of evidence showing the efficacy of providing services using telehealth technologies, increasing levels of consumer acceptance and vendor interest, and an emerging regulatory framework promoting its use. Some of the most promising advancements in the delivery of telehealth are in rural communities where access to traditional services is often limited. Determining your health center or organization's readiness to implement telehealth or scale it up is a necessary first step. This assessment can provide guidance, but also improve readiness in key areas such as organizational awareness and leadership, planning and preparedness, financial considerations, staff engagement, technical preparedness, and patient engagement. This is not an exhaustive list, but encompasses important factors to consider. Conducting this type of assessment will give you an opportunity to identify and address gaps and deficiencies in the key focus areas I just mentioned, and develop a strategic plan to address those gaps and monitor your progress. So how do I conduct a telehealth readiness assessment? Consider using a pre-established tool to ensure all staff involved and stakeholders answer the same questions and think about the same key focus areas. The organizational roles that would be best suited to conduct this type of assessment include program or office and practice managers, clinical directors or lead physicians, IT directors, and senior management. Having a team of 3 to 4 individuals who can discuss their results as a group will accommodate for any potential differences in understanding current state of capabilities and readiness to implement a telehealth program. There are several tools available to assist you in determining your readiness, which I have linked at the final slide. The Public Health Institute has created a fantastic telehealth organizational readiness assessment tool. The Pan American Health Organization has created one specific to COVID-19. There is one that is behavioral health focused called TCAT, or Telehealth Capacity Assessment Tool, and there are several others. So as I mentioned several slides ago, these are several key focus areas your organization or health center should consider. Let's dive into these one by one. Defining needed services. It is critical to understand the needs and motivations of the organization and its patients, and how telehealth can possibly meet those needs. Are there unmet patient needs? Did the clinic recently lose a provider? Are patients being referred to specialists out of the area? These questions and this step is especially important for federally qualified health centers and rural health clinics, as these practices are often located in very rural areas where specialty and behavioral health services are often referred out. Patients often face long distances between home and specialists, and additionally, the team conducting this assessment should define a shared vision and set of priorities or goals for the telehealth program. Organizational awareness and leadership. So your practice or organizational leaders must take an active role in supporting telehealth. Leadership buy-in is a critical step. Without it, your efforts will be challenging. This will support staff engagement and address concerns from staff who are uncertain about change. Senior leaders should identify telehealth champions in each practice, such as program managers or physicians. Some questions to ask or consider. Has the organization appointed a senior level telehealth champion? Does the organization understand the efficiencies and return on investment to be gained from telehealth? And has the organization committed to finding internal or external funding to support any costs associated with implementing or scaling up telehealth? There may be specific funding resources available for FQHCs and RHCS to pursue. Such funding sources are often listed on your local telehealth resource center website, the Center for Connected Health Policy, the Health Resources and Services Administration or HRSA website, and Primary Care Development Corporation or PCDC. Planning and preparedness. Organizations need to ensure that key stakeholders have a shared vision for the program, that the clinical staff is prepared for the process changes and new roles and responsibilities, and that the care protocols and training resources to support the successful introduction of telehealth into your already existing workflows are in place. Some questions to ask or consider. Does the organization have a clear understanding of the staff roles required to implement and operate a telehealth program? Examples of roles include program coordination, patient intake, training, equipment support and installation, marketing of the program, and more. And lastly, does the organization possess the clinical and operational expertise to design, implement, and manage a telehealth program? Building a workflow, for example, can be a very exhaustive process, and the individual tasked with that truly needs to understand all the roles and responsibilities of everyone involved in the service line or program. An additional level of preparedness to consider is technical. Organizations can assess their level of technical preparedness based on technology management practices, including review, selection of equipment, and logistics. Appropriate bandwidth, upload and download speeds will be critical to a successful telehealth program. Having your IT team at the ready to support telehealth and having an emergency management plan in place will be key to your success. Some questions to ask or consider. Does the organization have the appropriate bandwidth to support offering telehealth? In rural areas, especially where FQHCs and RHCs are located, can be lower or harder to build out than in urban areas and can lead to dropped visits or poor connections with patients. Does the organization have the appropriate and qualified IT staff, team, or vendor to work with to support this type of program? And lastly, has the organization reviewed or brought in for demonstration multiple telehealth hardware and software vendors to see what would be the most compatible with your health center or practice. Financial considerations. There are a variety of financial aspects to consider when implementing or scaling up a telehealth program. From an implementation standpoint, you run into startup costs, ongoing costs. What is your return on investment? Reimbursement considerations, both at the federal, state, private, and self-pay level, and even non-monetary benefits such as improved health outcomes, travel reductions for staff and patients, and improved patient engagement. Some questions to consider. Has the organization considered how it will fund the cost of this program? Some initial costs can include hardware and software purchases or leasing, training of staff, and even so much as potential provider contracts if you don't have the appropriate providers on staff. Has the organization reviewed the reimbursement landscape? Policies for state, federal, and commercial payers can vary widely. FQHCs and RHCS often have additional considerations to factor in, as there, prior to COVID-19, were restrictions on functioning as a provider or distance site and where the patient can be located. Those restrictions have since been waived so long as the federal public health emergency is in place, but it's important to review the reimbursement landscape prior to offering this service. Lastly, if reimbursement policies are not favoring your practice, have you considered if it will be sustainable to implement and offer telehealth in the long run? This is where a cost-benefit analysis may be helpful. Staff engagement. Successful telehealth programs truly rely on commitment and efforts put forth from practice staff. Staff at all levels need to feel comfortable with the telehealth platform being used and adequate training to help overcome any fear, shape staff perspective, and improve engagement. Staff who are well trained and enthusiastic about telehealth will share this with patients. Some questions to ask or consider. Has the organization clearly defined who will be involved in the telehealth program? Do these individuals have the minimum skill sets necessary to work with technology? Will additional time be given to those who are less tech savvy? Has the organization considered how to roll out training staff on the telehealth platform? Will it be in person or virtual? Formal or informal? Will it be train the trainer? Has the organization identified one or more telehealth champions at various levels who will keep the program and training moving forward once it is started? If the organization is using a telehealth program or platform from a specific vendor, do they offer training? And has the organization developed an ongoing and periodic telehealth education for after implementation if new staff were to join the practice? Next up, we have patient engagement. The ultimate success of a telehealth program is if patients buy into it. Taking the time to review your organization's patient population and factors such as health literacy, age, cultural or linguistic barriers, geographic location, and socioeconomic status will largely influence telehealth acceptance. FQHCs and RHCs often have a largely rural or migrant patient population, which makes some of these factors especially important to consider. Some questions to ask. Has the organization reviewed and considered patient demographics and other factors that could influence telehealth buy-in? Is the level of health and digital literacy of your patients known? Will these patients be able to connect to a telehealth visit from their home? Has the organization already implemented certain technologies such as an online patient portal or online schedule? If so, what has the usage been? And lastly, has a marketing plan been considered? How do you plan to conduct education and outreach about telehealth? So as I wrap up today's video presentation, I want you to think about some key takeaways. Proper planning can be conducted before telehealth technology is adopted, reviewed through implementation, and used to monitor progress in all of the key focus areas I've discussed today. If you're using one of the previously discussed scoring tools, which will be linked on the next slide, it may be time to analyze your organization's results. These results should be discussed as a team using the same individuals mentioned at the beginning of this video. If there are areas where gaps or deficiencies are identified, the team will need to address them. For example, if your scoring results from using one of the tools indicates a gap in technology capacity, your team will need to look at current infrastructure and find resources to increase bandwidth speeds or consult with an IT vendor for additional support. Proper planning equals success. And lastly, here are some of the scoring tools that I have mentioned with links to each. Thank you so much for joining me today to discuss telehealth readiness and assessment for FQHCs and RHCS. I hope you have a wonderful day.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.